Germany's economy is flat, but will that stop the demand for international healthcare professionals in Germany? I will break down here where Germany stands economically today and what are the implications of the present situation and what is the scope in near future for international healthcare professionals who wish to work and train in Germany so that you can plan your career accordingly. It is a fact that Germany's economy is in a stagnant stage in 2025 and the public spending is under strain because of increasing healthcare cost and increasing other costs, the reason for which is partially the trade wars going on across the world, the real wars going on between Russia and Ukraine, and many other factors which create the economic strain on the entire system. And since the healthcare institutions are also not out of the system, they also bear the brunt of it. And what they can do is reduce manpower or not increase manpower. That way they reduce the positions, and then that creates an artificial saturation where people feel the German job market is saturated for healthcare professionals. But actually it is not, because the demand, the number of patients is not going anywhere. It's not like software that okay, the user has become less or nobody is using it. Healthcare in worse conditions, when the economic downturn is there, when the poverty comes, the need for health increases and not reduces. More people become sick, and that time the need for doctors and healthcare professionals like dentists and nurses explodes. That's why the need is not going anywhere. There is huge share of German doctors who are reaching retirement age. That means somebody has to take their position. There are many doctors looking for a Nachfolger, other doctor, a qualified professional who would take over their practice and treat and take care of the patients in that area. They are not finding. So this problem will bring government as well, especially it has started in the area of need, like in the rural areas, that government is incentivizing people, doctors who take up those practices and take care of the population over there. So this will increase more and more in the near future. Already 15% of the physicians in Germany have an international background. That means they either possess at present a foreign passport or they used to have a foreign passport when they came here. So and this trend, the percentage is increasing. So here what we can understand is that structurally nothing has changed. In fact, the things that we have been criticizing, that the system is opaque, the processes are very slow, the government is doing something about it. They're trying to make things transparent, they're trying to make things easier, more streamlined, but the competition is increasing. Like people are more and more doctors have come to Germany. So obviously government is not ready for that. There is no manpower, there is no infrastructure to accommodate everything. So that way the competition has increased. But from the demand side, the demand has not decreased. The demand is still increasing every time. But competition has increased, and competition increase is a good thing. That means that will not make the path easy for you. It will be difficult. You will have to struggle for it, for which we prepare you through our YouTube channel, through our guidance, a one-time consulting session, or long-term consulting programs through integrated program. Or at present we are making our video course again in 2025, considering all the new factors that has changed in last 5 years, and that is in fact at present this week in a discounted phase, in a pre-sale phase, a roadmap course, a video course. If you purchase that this week till 17th, you will get in discounted phase. Otherwise after that you'll have to pay in a different price, so the link to which will be in the description section. So the resources that prepare you for this competition is there. Is it easy to secure a position or complete the entire pathway? No, it is not easy, but it is not easy anywhere in the world, whichever is worth it. If you go to some country which is not even worth it, then it might be easy. Or you go to some private university, you pay that hefty fees of 100,000 euros, and then that is different. But if you want to be in one of the developed worlds and like highly accredited PG programs, then the struggle is worth it. So don't worry about the competition. Don't worry about the need. The need is going to be there. Even though, imagine that these economic things are cyclical, that we all know. That means 2 years it is down, then again 2 years it's high, again 2 years it comes down. So last couple of years maybe it has been in a stagnant phase or declining phase. Maybe next 2-3 years again it will start booming. So are you going to then start learning the language? Are you going to then start the process, because the process itself takes 2 years? So that means that you have to have a overview at present and take a leap of faith that okay, this is the way, the structural demands and structural reasons are intact. The country is not going bankrupt. It's not like that they cannot pay their salaries, they cannot pay their doctors. It's not going to be like that. They are facing some problems at present, which they will eventually overcome, and then there might be boom. Even in the case when there is no boom in the economy and it stays stagnant or falls down, what will happen? The demand does not go away. And since things are regulated, it's not like doctors will be jobless here. Because if you are jobless, then they have to pay you more. Like you will be sitting at home and then they will be paying you. So they would rather have you work and then pay you. So don't worry about these things. If you are an engineer, for example, or other professional, then your worry is valid, because most of the fear mongering that is done via non-medical professionals about a career in Germany or life in Germany. Non-medical professionals, because there the concern is true that if you are, for example, a software developer and your company is laying off people, then you might be laid off. I see post almost every day in Facebook groups where somebody is an engineer and suddenly has been laid off. Okay, here as a doctor, the chances are very less. Okay, once you pass your probate site, then the hospital laying you off is very rare. Okay, so don't worry about that fear mongering. Be focused and improve yourself. Obviously, keep yourself updated about the information, because that is important. If you are just laid back that somebody else will process it and you are just based on some random information from Facebook groups or Instagram or Telegram groups nowadays, so then you can be in trouble. Or maybe ChatGPT. I created last video about ChatGPT, that how the tips that it provides is questionable and non-actionable. So you have to be careful and have go through reliable resources and progress toward your zeal, your goal. All right, I hope this video will encourage you towards your decision. I'm not saying here, because I know what people will comment. People will say that okay, you have a business and that's why you are commenting and you are promoting and saying that okay, Germany is good. I'm not saying that. Decision has to be yours. There are cons also about career in Germany that I have mentioned many times. That okay, if you have let's talk about cons also a while in this video, because I have tried to tell you that the situation is not so glim here in Germany. And if you're deciding, then that the news or the information that you are getting from Instagram and Facebook, that should not be the deciding factor that you would say that okay, I'll not go to Germany. But in the same time, let me tell you about the cons as well. That the salary that you receive in Germany, it's better than many other countries. But if you want to become rich, like as a doctor, you have to go to the US, because that kind of salary we don't have in Germany. We have a table-wise like tariff system where you have a fixed salary. Obviously, when you work more, then you receive more salary, but you have to work more. Like the band wise, it will not increase. Okay, so and every year increases a little bit. You have huge taxes. There is lots of regulation and lots of bureaucracy in everything. So there are there is lack of freedom. I would say that the freedom that allows you in India, for example, you can, if you have your place and money, you can, after being a fakat, you can start your own hospital. Nobody cares. Like, nobody cares means you're allowed to do that. Here you cannot just do that. You need to have a zits, a kasan zits, because insurance is your payer and not the public directly. So insurance has to approve everything, that okay, you are allowed to do this, you are allowed to do this surgery, this operation, you need to have this timings. So everything is decided by somebody else. So that free hand that you seek as a doctor, that you don't have in Germany. So those are the cons. Okay, the economy is not as booming as we have in India. The services like we have in India, that okay, 10 minutes delivery and all those things, that is not there here. The vibrancy that we have in Mumbai, at least, that we don't have here. So those are the cons. Obviously then you're away from your friends and family. That is also true. Language stays a huge barrier for a very long time. Okay, those are the cons as well. So to make this video balanced, so that you guys don't start blowing my comment section, I have included this cons as well. So decision is yours, but the reason that okay, the German PG system is oversaturated and now no foreign doctor should target Germany, that is not correct, not advisable. You look at your options and see if you have better option, go for it. Otherwise, Germany is not a bad option. It's quite a good option on the contrary. Okay, see you in the next video.